Hello, and thank you for coming forward as a potential kidney donor. It's important that you, as the donor, understand the risks following living kidney donation and that this process is undertaken voluntary under no financial, psychological or physical pressure from anyone. This is important and legally governed under the Human Tissue Act, and breach of this is a criminal offence. The following video will consist of the pros and cons of live donor kidney transplantation. You can keep this video for future reference to watch with your family, and a letter will be sent to you following clinic to summarise the key points discussed.
My name's Dr. Madeline Vernon. I'm a consultant nephrologist and I'm also the transplant lead here at Leeds Teaching Hospitals. The information we will discuss today is based on a summary of both national and international follow-up data on living donors. This is good quality data with follow-up between 20 and 30 years. We know that living kidney donation is the gold standard treatment for an individual with renal failure. The 1 and 5 year graft survival rates in Leeds from living donors are 97% and 90% respectively, versus 94% and 84% from deceased donors. This means that kidneys donated by living donors are, on average, likely to last for longer, with the average being around 20 years. If the recipient is not yet on dialysis, there is also the advantage that the operation can take place before the need for dialysis, which can be detrimental to overall health, particularly if the recipient is on dialysis for more than 6 months. Although transplantation from a live kidney donor is the best treatment we can give a patient with kidney failure, this is not the same thing as guaranteeing it will be a success. Overall, 1 in 50 live kidney donor transplants fail within the first few months following surgery, and we sometimes do not establish a cause for this. In Leeds, the surgery is keyhole and recovery is fast, but we suggest you take 6 weeks off from work. Any monetary loss to the donor can be reimbursed by the NHS. Please speak to your live donor coordinator for more information on this. Following completion of investigations of the living donor on the assessment pathway, the donor will be seen by a surgical colleague who will go through any additional risks of surgery and anaesthesia.
Live kidney donors are selected groups of individuals. They are healthy individuals who would have donated one of their kidneys. Their health is well preserved. However, we would need to do monitoring, what we call as health MOT, every year. Their physical activities or their well-being is generally reported very positive. There are minor risks with donating a kidney. About 1 in 3,500 individuals may experience a mortality, which means a risk of death. And those data are consistent over a few decades now. What that means is every 3,500 individuals who donate kidney, 1 may die sadly. However, the life expectancy, which means how long you live your life, is not majorly different compared to general population. There are also other minor risks around the operations. These are risk of hospital-acquired infections. These are mainly around your wound, sometimes around your chest and water infection. Some individuals are also increased risk of clots, which is a clot in the calf muscles that can very rarely cause pulmonary embolism. And we do take a lot of care to reduce those risks. The other risk we observe when we follow the individuals after donating kidneys, as general, when patients get older, about 1 in 5 individuals in general population will require medications for high blood pressure. This is to reduce serious medical problems such as heart disease and stroke. The need for such medication is little higher in individuals who have donated their kidneys, which is about 1 in 4 kidney donors eventually would need some form of blood pressure medicines. Some kidney donors may also develop a leak of protein from their single kidney that occasionally requires specific treatment. Recent studies have also shown an increased risk of developing gout, which is a painful inflammatory condition of the joints. Very rarely, individuals who donated kidneys may experience a kidney failure. The most recent comparison of healthy individuals, about 3,000, comparing to the same number of live donors with an average age of 40, and when they followed them of 25 years, about 150 individuals from healthy group and about 180 individuals from donors would have died, and one person in the healthy group would have developed kidney failure, as compared to 5 in 10 individuals from living kidney donor group. What that means is you have a 5 to 10 times increased relative risk of kidney failure, but your absolute risk is less than 1%. Please note, there is other evidence which suggests any modest long-term worsening of live donor cells does not leave them any worse off than general population. However, if the kidney donors develop kidney disease in a single kidney, the rate of progression of kidney failure is faster than having 2 kidneys.
Pregnancy following living kidney donation and the overall outcome of successful pregnancy is similar with non-donors, but there are certain risks which require careful planning and antenatal care in the renal obstetric clinic. From maternal health perspectives, there is an increased risk of preeclampsia, which is a pregnancy-specific condition that can affect different organs and give rise to high blood pressure, renal problems and protein in the urine. Every pregnancy has a risk of preeclampsia, but it is increased with those with 1 kidney and kidney disease generally. We can reduce the risk of preeclampsia by giving aspirin from 12 weeks to continue throughout the pregnancy. Preeclampsia can occur from 20 weeks gestation and treatment is delivery of the baby, which may lead to issues with prematurity depending on the gestation delivered. There is also a risk of worsening renal function in pregnancy and development of high blood pressure needing treatment in pregnancy. Fetal issues can include small growth for babies and regular growth scans will be required. Should a pregnancy be considered, we can discuss further in a dedicated renal obstetric clinic. We would follow women who had donated a kidney in that clinic during their pregnancies.
We have learnt from what previous live donors have told us that they sometimes find it upsetting to be on a hospital ward with people who may be seriously unwell. This can be worse if this is the first experience a live donor has of being a hospital patient. It is wise to be prepared for this, and we do not have a way to manage this differently. You will most likely be the most well person on the ward following your operation, and we would only expect you to be in hospital for 1 to 2 nights following your surgery before you are discharged home. Live donors have sometimes felt left out of the process after the surgery, partly because of the intense medical follow-up received by the transplant recipient. Live donors themselves do not require such intense follow-up. They are reviewed by the live donor coordinator team by telephone when discharged from hospital for the first week following surgery. They are then seen in clinic at 6 weeks after surgery by the surgical team. It is important to be aware of this shift of focus in advance. Following the 6-week review, the donor will have lifetime annual follow-up by the coordinator team. This annual appointment focuses on blood pressure, kidney function, risk of protein leak in the urine, and general lifestyle measures and well-being. Please be assured that the live donor team will always be contactable throughout your assessment, right through to post-donation, to answer any queries or concerns you may have. Thank you for taking the time to watch this video and for coming forward as a potential live donor. Volunteering to donate a kidney is a wonderful thing to do, but it is also an important decision and there are lots of things for you to consider. We hope this video has been informative and we wish you all the best with your ongoing assessment. We're here to support you every step of the way.